talking about positioning and attachment, right? So these are different ways how a mother can hold the baby. They can hold it with at the crook of the elbow or using the wrist, right? And so these are different ways. If you're lying down, how the baby can be held, all that. And if you're sitting, how the baby can be held, etc.
Excuse me, madam.
Yes.
Madam, we missed the last part because at the last part, your voice is breaking.
Yeah, from where? Did you hear attachment and positioning?
Madam, we were at this slide.
From here, okay.
Yes, madam. Yeah.
So, with regard to assessing a breastfeed, there are three things we look at: positioning, attachment, and suckling pattern. Right? When we say positioning, we mean how the baby is held to the breast. That is, baby's head and neck should be in one line. Mother's hand should be supporting the nape of the neck and not pressing on the head. And there should be close contact between the baby and the mother. What we mean by attachment is how the baby is on the breast. So if the baby's mouth has to be wide open, and more of the lower areola should be inside the mouth than the upper areola. The chin should be indenting the breast. And the lower lip should be turned out. So those are the factors. By observing a breastfeed, you know whether it is okay or not. Suckling pattern means baby will have 2 to 3 deep sucks, then pause. The pause is actually for swallowing the milk that comes in. So these are the three things we assess when we are breastfeeding, when we are checking breastfeeding technique in a mother. So there are different types of holds which you don't need to know about, but what you need to know is mother can hold the baby in any way that is comfortable to her. But here also you can see mother is supporting nape of the neck, head and neck are in one line, and they are very close to the mother, meaning positioning is good. This is called the underarm hold or the football hold, which is commonly used for twins. This baby is being supported by the, again with one finger to the head and by the wrist as well as the hand of the mother. Then again you can see similar supporting. Mother is sitting in bed. Here you see the head is supported by the elbow of the mother, right? So here again lying down mother using the underarm hold. You don't need to know different mechanisms or names. You just need to know the principles of what is good position, what is good attachment. Okay, so even sitting position baby can feed as long as head and neck are in the same line, right? And you don't press on the head and they are very close. Here you can see attachment is good because mouth is wide open and we can barely see the areola. So moving on to attachment again, if the baby is attached well, the mouth is wide open at a wide angle. Most of the areola should be in the baby's mouth. Right, so there are a few pictures to show you what good attachment is like. So this picture, can one of you tell me whether attachment is good? Good or bad? Quickly, need to finish now.
Bad.
Yeah, this is bad, or we don't use the word bad when we come to breastfeeding because those are called judgmental words. We say attachment needs improvement, right? So here the mouth is not wide open. Most of the areola we can see, which means it's not inside the baby's mouth. And as you very correctly pointed out, attachment needs improvement. So why is this attachment so important? When it is the areola that has to go to the baby's mouth, not only the nipple. When the areola is put, because of the suction effect, right, it is drawn into the baby's mouth and the nipple goes and touches an area between the soft and the hard palate. That stimulates the sucking reflex in the baby. If the areola is not going into the mouth, it will not stimulate sucking reflex in the baby, right? And that will lead to baby prematurely giving up and not going to the breast. So this is why just putting the nipple alone, one reason nipple gets damaged. Second reason, sucking reflex is not stimulated if you don't put the whole areola in. Right, so that's another picture. Not so great, the mouth is not open so well. Again, another picture comparing, right? So the poor attachment one, most of only the nipple is there. Well attached one, the nipple is inside the mouth, not only the nipple but also the areola. You can see the lower lip is turned outside, baby is in close contact, and mouth is wide open in optimal attachment. So again, this one, can someone tell me attachment, do you think it's good or needs improvement?
Should be improved.
Yes.
It should be improved.
Yeah, it's not so bad actually. Mouth is quite. Why do you say it should be improved? Yeah, why? Why do you say it should
neck
be
support
improved?
is less.
The mouth is open pretty okay. It's not great. I agree with you. Yeah. Neck support paid
Neck support is less.
attachment. Attachment is not positioning. I know. Neck support is part of positioning. Positioning is how you hold the baby. Attachment is how the baby is attached to the breast. So I'm asking about attachment. Do you think the mouth is open wide and is most of the areola in the mouth? Those are the two main questions you have to answer. So with regard to mouth opening and areola, most of it seems to be in the mouth. So attachment is, I think, okay in this. But as your colleague mentioned, we can't see about the neck support. So we can't actually comment about the positioning. There are two things. Right now, what about this baby? Can someone, Ashan, can you comment on the positioning? Ashan or Abhisekar, it doesn't matter. Somebody, can you comment on the positioning? Do you think position is good or satisfactory? What is position? Position is head and neck in one line. Is the baby turned towards the mother? Is the head being touched? Can someone tell me what you think about positioning, just to check whether you understood? Yes, Bandara, go ahead. Or yeah. Divisarani, you can tell me about attachment. Bandara, go ahead.
It should be improved.
Yes, it should be improved. And what is the reason you're saying positioning is not good? Can you explain to the others?
It should be improved, madam.
Yeah.
The baby is not turning towards the mother.
Very good. Yes. Okay. What about attachment?
The baby turning towards neck and the head position. It's not in the same.
Yeah. You're absolutely right. Baby is not turned that way. Head and neck also not in one line. Yes. What about attachment? Can some, yeah? What about attachment?
Attachment. Yeah, attachment. I think open enough.
Not open enough. So yeah, again, it needs improvement. And most of the areola is out, right? So this has poor positioning, poor attachment. Good. So what are the reasons? Bottle use, inexperience, mother, functional difficulty, lack of skilled support. And so this is why we say not to give bottle feeds, in addition to it being unhygienic, because the way that the baby has to suck on the bottle is different. The whole thing is not going inside the mouth, and this causes confusion in the baby. It's called suck confusion, and this is one reason why bottles are not recommended. So if there is poor latch, it causes damage to the breast with sore nipples, breast engorgement, reduced milk production, and with regard to the baby, less milk transfer and poor weight gain. Okay, so there are some breast conditions which you will come across as doctors, right? There's a presentation and a quiz on that, but I will just run you through some little things just to get your mind stimulated. So there's a thing called full breast. When the milk comes in, the breasts are full. And there is also something called breast engorgement, which is onset of when it happens too much. So the full breast will have milk easily flowing. Engorged breast, the whole breast is red and swollen. Milk flow may not be there. Mastitis, the whole breast is not involved, only one part of the breast is involved. So if the breast is engorged, meaning one full breast is red and swollen and painful, it's important that you have to continue breastfeeding, but only maximum 20-30 minutes, right? You have to give a pain relief to the mother. You should not put warm compress, meaning do not use hot towels and stuff because it will cause vasodilation. After the feed, cold compress can be given, and breast should not be emptied by expressing milk, because here there is too much milk. There is lot of stimulation, but breast emptying has not happened because of poor attachment, right? So here we don't want to empty the breast and stimulate milk production. We just want the baby to take what it wants, so that the next time feedback inhibitor will reduce the amount of milk and cater it just enough for the baby and not too much. This is cracked nipple. So if the baby doesn't latch to the areola but latches to the nipple, this is what can happen. It can cause infection for the mother and it can be very painful. So what we need to do is continue breastfeeding with correct positioning and attachment, so that baby doesn't latch on the nipple but latches on the areola. Local applications should not be used. Antibiotics can be used, especially if it is going on for 1 or 2 days. Again, more details on all of these breast conditions are there in your LMS activity and quiz. So again, if the breast is very large, it needs to be supported in order for the baby to be able to attach. Otherwise, it is difficult for a baby to attach. So mastitis is where only part of the breast is involved due to blockage of a certain amount of milk ducts. You can see only part of the breast is red, but milk is a good medium for microorganism. So if it is there for more than 24 hours, we need to give antibiotics. Analgesics also should be used. And the important thing is we have to correct the cause. So sometimes it's the way that the baby is held, position. Sometimes it's because mother is holding the breast between 2 fingers, called the scissor hold. Again, given in your LMS activity, sometimes it is tight underwear. Whatever the reason, we have to correct it and vary the position, and we can massage the breast towards the nipple so milk flow is improved. If we don't treat mastitis, it can end up in a breast abscess, which will need incision and drainage in addition to antibiotics. But the important thing you have to realize, the main thing is you continue breastfeeding from the affected breast after giving pain relief to the mother. Because if you don't continue breastfeeding, it will get more and more engorged. Right. So even if the baby is very small, this is a picture of a preterm baby from our unit, right? Sometimes babies are as small as 500 grams and as less as 24 weeks. These babies can also be given breast milk, but it is given through either cup or tube. Right. So here you can see mothers giving kangaroo mother care. That is, the baby is held between the 2 breasts. It is specially used in preterm babies to facilitate establishment of breastfeeding, but it also has many other advantages, as you can see: better temperature control, better respiratory stability, colonization with maternal flora, right? Less infection, less stay in the hospital, all that. So these mothers of small babies, if the baby is unable to suckle from the breast, maybe because it's sick or small, then in that situation, we train the mother how to express breast milk. So you hold the breast between, so on either side of the areola, push it back, wait a little, and you compress it, right? So this is trained to the mother. Only one drop may come, and hand expression is what is promoted, not expressing with pumps, because pumps, one thing, it can cause infection with lots of tubes, and second thing, when only little bit of milk comes in the first few days, it will go inside the pump and we can't give anything to the baby. So manual expression is both cleaner and more efficient. So breast milk can be expressed into a cup and we can give the baby directly by the cup. Or here what you can see is tube feeds which are falling by gravity. Again, there's a video on tube feeds and there's also another activity on feeding the small baby which you can do. This is how cup feeds are given, right? I couldn't upload the video, it's too big. I need to work on that a bit, right? You need to know how cup feeds are given as well. So again, this is a mother giving cup feeds. So these are pictures of my small babies. So these babies were born with like 600 grams, 500 grams at 26 weeks, 24 weeks, and they were exclusively breastfed. Initially, it was given through tube, then cup, and now they are developmentally normal children. So even if they are as small as 500 grams, still they can be nourished only with breast milk. There is no need to give formula. But of course, they were given vitamin supplements like multivitamins, which are needed for preterm babies, right? So in summary, we learned about why we should breastfeed, how we should do it, how do we assess for inadequate breast milk, how does it work, how to manage complications, and how are sick and small babies given breast milk. So you have not learned about growth. When you learn about growth, you will understand. For smaller babies, when they are born small, they have to go along the same birth trajectory of that same line. So these are some of exclusively breastfed babies. The one on the left is a very sick 32-weeker. The one on the right is a term baby, but exclusively breastfed. So not only singleton pregnancies, we can also exclusively breastfed. This is a successfully breastfed twins. These are one of our triplet pairs who are exclusively breastfed, right? So all three babies were given only breast milk until they started complementary feeding. And this is a set of quadruplets who we had also managed to exclusively breastfeed. So yeah, that's to tell you that even if it's a multiple pregnancy, we generally are able to exclusively breastfeed. So this is again a 600 week who we have exclusively breastfed. Thank you. Do you have any questions before we end up? Okay, so there's a question on chat. Doesn't breastfeeding with a breast stabilizer lead to infection if the baby pus eats? Yeah. No, it doesn't really. I mean, you're not going to give the baby to drink the pus area because if pus is flowing, you have to do IND. Once the IND is done, baby can be given to feed. Usually the pus is not coming from the same place as the milk is coming. That doesn't happen usually. So even though there is a breast abscess, usually either you have to treat it with antibiotics or IND. After the IND, it can be given. The problem is usually the pain. So if the mother can get adequate pain relief, it can be given. It's not that pus flows with the milk. That rarely happens. And that will be resolved as soon as the drainage is done. It's not a problem. Yes, yes, breast milk can be stored. I'm sorry, I didn't touch on that. I think I haven't included it in the activity either. Breast milk can be stored. So once breast milk is expressed, it can be stored in room temperature for about 6 hours, right? And it can be stored in the normal compartment of the fridge for 24 hours. And if we put it in a freezer, we can keep it for 2 to 4 weeks, right? So actually for preterm babies, what we ask to do is when we allow parents to go home and come, if not, unfortunately not during this COVID time, but I used to allow them to go and come. So what they used to do is they express the milk every 2 hours, like they do 2 to 3 hours to maintain lactation, put it into a cup, close it with a good lid, label the time and day, and you kind of use it. Then when they come, they give the fresh milk. What to do if the mother is convinced that she doesn't? So that is up to us. That is why I'm teaching you, taking so much time to teach you to counsel the mothers to breastfeed. Most of the time, the mothers haven't got all the information. She gets the information from the TV, right? Which will, you look at all the nice advertisements on, it's not, you don't get to advertise infant formula, but you see the other follow-up formulas. And when they look at the anchor ad or something else, mothers think that, okay, wow, brain growth happens with the most expensive formula. So it's up to us healthcare workers to tell her the advantages and to counsel. It's called breastfeeding counseling, and that's one of the things that we need to do. That is why I have taught you all the advantages and disadvantages, because we need to talk to her, to the family, and counseling is our responsibility. How often switch between two breasts? So for one breast you use for one feed you should use one breast, and the next feed, which happens in 2 to 3 hours, the next breast. You should not switch breasts between one feed. Any other questions? Is it okay to heat milk? Yes, it's like this. How we heat milk is we don't put it on the stove and heat, right? So once we refrigerate the milk, you have to keep it out. Or, you know, if you have frozen it, you can keep it in the normal compartment the day before. And then you heat water. So basically you put it in water bath. You heat water in a container and you put the milk container inside the water container. You don't directly heat the milk, and you have to wait until it reaches something like body temperature. Otherwise the baby refuses, because babies use, when they are getting straight from the breast, they get it at body temperature. So we have to give it not too hot, not too cold, and you can't put spoons inside and turn it. So you can just keep a drop on your hand, and when you are feeding that, you can't feed with the teeth and the bottle. It should be fed with the cup, because if you feed with bottle and teeth, baby will get confused and stop getting from the breast. If the mother is infected with virus, yes, some viruses can go. The only virus we are concerned about at the moment is HIV, right? But the good thing is, if HIV has been found early and treated, most of the patients that come to us have negligible viral load. So if that's the situation and she is compliant, and will come to the health sector to make sure she breastfeeds without, you know, getting a crack nipple, because if the skin breaks, viral transmission will be increased. So therefore, even in a mother with HIV, although there is a chance that the virus can go, if the viral load is low, the chance is very small. And the other thing is, mothers have antibodies, no? So even mother with chicken pox is advised to feed the baby, because most of the time baby doesn't get, because mother's antibodies go and protect it. So even mother with, I was going to say that it is recommended that COVID mothers feed their babies, because the benefits of breastfeeding outweigh the disadvantage. We are not sure. So at the moment, breast milk which has been tested for COVID has been negative. So it has not shown to transmit COVID. The way that the baby can get it is maybe through the respiratory droplets. So mother is actually asked, anyway, they are asked to wash their hands and wear a mask when breastfeeding. But you don't have to wash the breast or anything, only having a wash once a day. Hold on. So is direct feeding good in engorgement? Yes. Only direct feeding should be done, unless it's a preterm baby who we can't give direct feeding to. Because if you try to express, the more milk you take out of the breast, the more milk will come. Then there is a question, what should to do if the mother does not produce enough breast milk? Okay, so you have to go and see why that is happening. Is the mother unhappy? Is the mother sad? Is she anxious? Then a psychology referral. Then you have to see whether her breastfeeding technique is correct. We talked about this now. These are the most common factors. Or else we have to correct it. Make sure she gives the night feeds, she is confident, she holds the baby correctly, get her to express 2 hourly. So those are the things. So I see like about 5,000 babies every year, and generally maybe one might need formula feeding, sometimes because the mother died, or very rarely does anyone need formula feeding. Some babies breastfeed until school age, while some are formula fed after few years. Yeah, that is what I showed you in the slides. There are differences in IQ. We don't tell to breastfeed till school age, but until the baby lets go. What it has been shown is the longer they are breastfed, the better brain development. So the IQ is definitely higher, and behavioral traits are different in breastfed babies. Then is there a need to know about Breastfeeding, yeah, even if she has postpartum depression, unless she's planning to murder the baby, or unless she's harmful, we have to continue with breastfeeding. Is that before feeding, drinking hot water? No, that is absolute nonsense. Mother can be starving if she wants to. There is no need to drink water. Only thing is being hydrated, the mother will feel better. Whatever the mother eats or drink is not going to affect. It's not that you drink from the mouth and it's coming from the breast. Doesn't happen. Mother can wear whatever she wants to right. Only thing is the bra size that she wears, because the breast becomes big after, when in lactation time, it has to change. You have to wear a proper fitting bra, but otherwise any other clothing is okay. There is no restriction on clothing. Can we make powdered milk using breast milk? How can you make powdered milk? Don't think so. You mean to like evaporate it and make? I don't think it's been made yet. You can try. Some mothers feed babies with formula milk in the early days because milk production is not enough. Is that good? I think I answered the question, isn't it, during the presentation? It's very bad. Even one drop of formula milk increases risk of allergies. It causes your early programming so that the baby will be at higher risk of obesity and diabetes. So even one drop of formula milk is very bad. What you have to take the message through is mothers think, I think many women think they don't have enough milk because maybe they have not got skilled support. It is not an easy thing to do. You need some help. It's just like when you were a baby, you got some help to learn how to walk or to talk, or you got some help for your A level, like that. It's a skill. If you learn to drive, you don't just drive. No, you learn from somebody. Just like that, the help in the state sector is better than in the private sector. So many people born in the private sector, because of pressures of discharge, various things, they are on formula milk because monetary gain is the main thing there. But in state hospitals, they are shown. But when they go home, different people say different things. So that is what is up to us. Before we discharge from, see now, I'm in a neonatology. So before we discharge the baby, we ensure that breastfeeding is happening properly. Even if it comes to a pediatric ward later, when you take the dietary history and you see that they are on formula, you have to counsel them and try to show them that formula milk is not good because it causes many problems. When you go to pediatric wards, you see baby, if there are babies in diarrhea side or having bronchiolitis, they are most of the time on formula milk. Babies on breast milk are healthy and don't come to the hospital. So therefore, it's not good at all. The whole point of the first part of the presentation. Any other questions? So that was a lot of questions. I'm very happy to know that you had listened. That was very interesting. So there are some activities on your LMS. I hope you guys have access, because I put a lot of stuff on breastfeeding as quizzes, so to make it more interesting for you. So please go through that as well. That will supplement what we talked about, because it's an important thing, but this is the only place in the curriculum where we talk about it. Any other questions? Okay, so if there are no other questions, we can wind up. Do go through the stuff uploaded in the LMS to you all, right? If you all are having problems with the LMS, you should let us know so it can be rectified. Okay, then, thank you for joining. So I'll speak to you again, I think, day after tomorrow. Yeah?
Okay, madam. Thank you, madam.
Okay, thank you then. Have a nice day.
Thank you, madam.
Thank you,
Okay.
madam.